Chow Chow ears are small, thick, upright, and because they stand erect and are heavily furred at the base, problems can begin quietly and go unnoticed. Most ear infections do not start dramatically. They begin with a slight increase in wax, a faint smell, mild head shaking, and by the time discomfort is obvious, inflammation is already established. Today, we are going deep, not just how to clean, but how the structure works, what normal truly looks like, what early infection looks like, and how to avoid creating problems while trying to prevent them. Before cleaning, we understand anatomy. A dog's ear has three parts: the outer ear, the ear canal, and the middle and inner ear. We only work with the outer ear and the entrance of the canal. The outer ear, the pinna. Gently tilt the ear slightly backward to look inside. On the inner surface, you will see natural folds, small ridges, curved contours, cartilage buttons. These are sound funneling structures. They help collect and direct sound into the canal. But they also create small creases where wax, dust, and moisture can collect. When cleaning, these folds must be wiped gently, but thoroughly, not aggressively, thoroughly. Below the visible opening, the canal runs downward vertically, then sharply inward horizontally. It forms an L shape. This matters. Fluid placed in the canal does not simply drain out. If too much liquid is introduced, it can pool at the bend. And pooling moisture in a warm canal creates an ideal environment for bacterial and fungal growth. This is why we never flood a chow's ear, even during treatment. A healthy chow ear is pale pink, odorless, dry, with minimal visible wax. You may see light brown wax. You may see small amounts of dust mixed into it. Wax is protective. It traps particles before they travel deeper. Not all wax indicates infection. Overcleaning a healthy ear disrupts its balance. Watch for dark brown to black wax, thick, sticky discharge, strong odor, redness, swelling, frequent head shaking, pain when touched, head tilting. Dark brown to black wax often suggests fungal overgrowth. A sour or yeasty smell is also a warning sign. If wax reappears quickly after proper cleaning, inflammation is present. Catching it early means short treatment. Ignoring it leads to chronic cycles. Once a week, gently tilt the ear back. Look, smell, observe your dog's reaction. You are checking for color, odor, excess wax, sensitivity. Most infections are visible before they are painful. 2 minutes weekly prevents months of treatment. For maintenance, use a soft cotton wool pad or soft tissue. The pad must be damp, not dripping. You may dampen it with F10 disinfectant solution or apple cider vinegar diluted 1/3 vinegar to 2/3 water. The pad should not release liquid when squeezed. We wipe, we do not irrigate. Gently clean the inner surface of the ear, all visible folds and ridges, and the entrance of the canal only. Do not insert deeply. Do not probe. Do not use sharp objects. Surface cleaning only. Surface wiping can be done weekly as needed. Full canal flushing with liquid cleaner should not be done more than once a month unless directed by your veterinarian. If wax is present inside the opening, use a veterinarian recommended ear cleaner. For an adult chow, up to 10 drops per ear maximum. Place the drops into the canal entrance. Immediately massage underneath and behind the ear. You should hear a soft squishing sound. That means the solution is distributing down the vertical canal. Then allow your dog to shake. Shaking is part of the cleaning process. After shaking, use a dry cotton pad to wipe the outer ear, the canal entrance, and importantly, the fur at the base of the ear and along the cheek. When dogs shake, debris travels downward by gravity. If that expelled material sits in the fur below the ear, moisture and wax can migrate back toward the ear canal. Routine flushing should not be repeated more than monthly unless directed by your veterinarian. Excess fluid creates imbalance. We'll list the tools we use in the description for those who want exact references. If wax returns rapidly, odor persists, redness increases, or discomfort continues, cleaning is no longer the solution. Infection is present. Veterinary treatment may include antibiotics, antifungals, and anti-inflammatory medication. Even when administering medicated drops, do not overfill the canal. More liquid does not equal faster healing. Pooling delays recovery. Water inside the ear canal is one of the most common triggers of infection. During bathing, avoid directing water toward the ears. Do not spray directly into or over the ear opening. When rinsing the head area, gently fold the ear flap forward so it naturally covers the ear entrance. Lightly hold the flap against the skull to shield the canal from spray. Do not press tightly. The goal is protection, not sealing. After bathing, check the ears. Dry the outer ear surface. Ensure no visible moisture remains at the canal entrance. Do not push cotton balls deep into the canal. Blocking moisture inside is worse than brief exposure. Water trapped in an L-shaped canal does not drain easily. Chow Chows are not traditionally ear plucked. Ear hair helps guide wax outward. It forms part of the natural clearing system. Unnecessary plucking irritates the canal and increases infection risk. Only remove ear hair if specifically advised for medical reasons. Dogs sometimes lick each other's ears. If your chow repeatedly licks another dog's ears or allows theirs to be licked excessively, inspect both dogs. Excessive ear licking may indicate a scent change from infection. It may also introduce excessive moisture into the canal. Moisture plus warmth increases risk. Do not ignore persistent ear licking. Untreated infections can lead to chronic inflammation, thickened canal walls, narrowed ear canals, hearing impairment, repeated antibiotic cycles. Chronic ear disease becomes progressively harder to manage. Prevention is always easier than correction. Ear health reflects balance, structure, moisture control, maintenance, consistency. When we understand the anatomy and respect the limits of the canal, most ear disease is preventable. Prevention is always easier than correction.